Hello, I'm Dr. David Krakowski here at Chatham Animal Hospital in Cary, North Carolina. This is my friend Ollie, and Ollie and I are going to demonstrate what we call the positions of protocol in a mini physical exam. And these are things that are intended for owners to do with their own dogs, specifically with puppies, because we utilize the puppy's natural tendency to allow these particular positions, and they gain trust in us over time. And if we continue to do these things over their young puppyhood into their young adulthood, say 6, 9 months of age or so, at least 6 months, it'll become second nature to them, and you'll always be able to do it. The first one that I like folks to learn is to open the mouths. Put your fingers down in there, one finger, your index finger, just so that the pup is used to you doing this type of a procedure, that they don't try to bite you. Touching their mouths, putting your fingers in the mouth is perfectly fine, no big deal. It helps to remove all the little things that they're going to try to get into in the course of their lives, and later on it can help with dental care as well. The next one is to just check their ears, and you want to lift the ear up, look inside the ear. You want it to be nice and pink, no smell, no odor, no discharge. It's easy to forget to do this and for an ear infection to kind of get out of hand. I'm sorry, Ollie. Just a daily or even weekly check can save you a lot of trouble and save them a lot of discomfort. The next one is to take a look in their eyes. Sometimes they'll get a little something in the eye, especially a dog like Ollie. When his hair is growing longer, his hairs interfere with the eye, and they'll get this discharge you see in the corner that he's got. Now that's gets much worse as the hair gets longer, and they tend to get a dermatitis or an inflammation underneath that area where it stays wet all the time, especially if it gets crusty. So having them used to allowing you to spread their lids. Okay, no, I'm getting fed up. Sit down. Ollie, sit. Ollie, stay. Good boy. Is a good thing. The next item is to manipulate their feet. And that's very important because we want to be able to trim their nails and get burrs out of between the toes or anything else that we need to do. We do have patients that actually have to be anesthetized to have their nails trimmed, and we don't want to have to do that. And it's actually something you can do at home. It's better for the pet to keep their nails shorter, and it's also a little less expensive for you if you're able to do it yourself. We're always glad to do it for you, but that's something you can certainly do at home. The next portion of this is designed to take advantage of all the natural tendencies of the puppy to try to please you. The first one is to lift them up, putting your thumbs inside the chest, the crook between your thumb and index finger underneath the arm, and have them stand like so. If the puppy's small enough that you can pick them up and kind of talk to them and look at them, it's really a trust exercise. And you want him where he doesn't struggle or try to get away from you. And puppies will naturally let you do that. And the idea is when you're 7 years old like Ollie, that you'll still be fine if someone does that to you. It just assists in letting you do the various things that you need to do for your pet over time. The next protocol position is to lay them on their backs. And this is the favorite one of everyone, including me. And you just want to have them nice and calm. Any of these positions we like to have continue for 1 minute. If they start to struggle when you're teaching them this, wait till you get a nanosecond of compliance and then let them up and tell them they're good dogs. But most puppies allow this perfectly fine. Many dogs will get where they just will not tolerate this as they get older, but they will if you do it as part of your daily routine with them. The next item is to put your hand on the head. And I like you to hold the head like this. You see where my fingers are? And it's just to teach them to allow you to do this without trying to bite or play and so on. And the reason is that we use it as a disciplinary action. So if he's doing something he's not supposed to do, I can say, Ollie, no, very sharply like this, push down on his nose, push his bottom down, and he'll stop immediately. At this point in Ollie's life, I can just say the no and not do that part, and he'll stop whatever he's doing fairly quickly. And it doesn't require a lot of boisterousness or hollering or getting upset. I can just really tell him a sharp no, and he'll quit doing whatever he's doing that is getting him in trouble, which he likes to do. And the last position is one that people sometimes don't like, but it really is useful in teaching the dog that you're the dominant person in the household. And in the end, that has to be the situation where they know that you're their protector. And if they allow this kind of a position, they accept you as their protector, and they also accept your dominance over them. You see that I lay my wrist across the inguinal area. I'm holding on to the down leg with my left hand. I would have my wrist over the neck, and I'm holding the front leg, the down leg, with putting a little pressure above the elbow to make him extend it. This allows you to examine him, but more importantly, it emphasizes that you're the dominant person in the household and you haven't had to do anything else besides have him lay on his side and talk nice to him. So that concludes our mini physical exam and positions of protocol. I hope you found them useful, and Ollie and I will see you next time with another video from Chatham Animal Hospital.